Alright, good morning. I'm going to do a tracheostomy care. So the first thing I'm going to do is check the patient's chart. I'm going to gather any necessary information that I need to go into the patient's room. So I'd also notify what kind of trach they have, if it says in the chart. I'll gather the necessary things. I'll need things for suctioning, and I'll also need the tracheostomy care kit. And I have all my necessary supplies. I'll knock on the patient's door, introduce myself. Hi, my name is Amy and I'm a respiratory care student with the respiratory care department. And today I'm gonna do a trach care with you. And so the first thing I would always wash my hands, and then I'd check the patient's ID band. So then I go ahead and explain to them, all right, Mr. Johnson, so today I'm gonna do a trach care with you, which is I'm gonna clean around your trach, and that way we keep it sterile and nice and clean so we don't get any infections or anything like that while you're here. And so I will begin. And so first I want to go ahead and listen to your lungs before I begin, and get down the vital signs before I begin with the patient. So when I'm ready, I would always apply the appropriate PPE. So I'd always apply my gloving. And then I'd also apply, so like if we have like any sign that we might have any splashing, I'd put on a face shield just in case anything like that. Or if we have really bad things, we can also wear a gown if we feel like we need that extra protection for us. So first thing, I'd always look at a patient after I did all the vital signs. I'd always check the trach, kind of see what kind of trach I have, and to see the size, so that way I can, if it's a inner cannula needs disposed or anything like that, that way I have the appropriate size to replace it with. So when I'm ready, I would always, after checking the size, then I go ahead and get my kit ready. So I'd always open up my kit to make sure I have my normal saline and peroxide. I'd always have a basin to pour the stuff in. That way I can have a clean area so to clean out everything. So when I have that all ready to go, I would go ahead and I can remove the old gauze pad if I need to, but I always want to place a sterile drape just in case if I have anything, I don't want to get anything on them. And I would suction out. I would remove, if it has an inner cannula that can be removed, I would remove that. And I go ahead and suction out before I do any of the trach care. I'd always make sure I get any of that excessive secretions that may be built up in there. Now when I'm done, there's like little clips that for some that can come off, and some of them are just cannot be replaced. So those ones, so what you do, so you would always remove your old gauze pad and dispose of it, but you would take your peroxide with the inner cannula that has to go back in. You would take it and you clean the inside of it with the peroxide, make sure you get all the gunk off of it, anything around it, and then you would always dispose of the that cleaner that you use. You can use a pipe cleaner. It may come with a brush with your kit, and then you take your normal saline, make sure it's washed out, make sure everything is clean, that peroxide's off, and it's nice and sterilized again. And then always when you take out or clean around the trach, you always want to clean around the stoma. So you would clean on the outside of the stoma, and then you also clean underneath around it, where it is around the neck plate. There might be a plate there with the thing, and you just clean around it like that. And you dispose of your thing that you used to clean it with, so you don't infect anything else. And so when you are done, you have or if you need to replace your the band around here, you can replace that. But when you replace it, make sure you hold the trach in place. That way it does not move on you. And you remove that, replace it with a new band. And when you replace the new band, always make sure you can fit 2 fingers underneath. That way you know it's not too tight and it's not going to cause any sores or anything around the patient's neck. And if you don't feel comfortable holding both and trying to replace it, you can have somebody that help you, another staff member that can help you hold it, just that way you know it doesn't move and isn't harming. And so when you're done, everything's ready to go. You always want to place a new gauze, 4x4 gauze on them. So you'd place it underneath the stoma, go around the stoma, and it'd just sit there around the stoma. That way it catches any other secretions that might come out around the stoma area. So after I'm all finished, I'd always make sure everything that I had used, anything like that, is disposed of. Any old gauze, anything like that, the drape, I'd always dispose of the drape, get rid of that. And I then go ahead and listen to the patient's lungs and everything, make sure everything is okay. And always check the vital signs. And the other thing, always, if they had something connected to them, like with the oxygen device, always make sure that is okay and make sure they're getting the proper oxygenation that they need. So I'd always, once everything is disposed of, I can remove my PPE. And I remove everything, take off my face shield, gown, everything that needs to be removed before I leave the patient's room, wash my hands. Then I go chart on the patient's chart, the date, time that I did the procedure to let the doctor and other staff members know.